Hi, I'm Kevin Knaus with InsureMeKevin.com, and today I wanted to talk to you about moving from covered California to Medicare. You're probably pretty excited that you're going to be turning 65, or if you're under 65, will be gaining original Medicare Parts A and B, and you'll be transitioning off of covered California. Well, you do have to consider that Medicare may cost more than covered California, especially if you have a lower income and you are receiving a hefty subsidy that makes maybe your Silver 94 plan really inexpensive, like under $50, because original Medicare has costs associated with it which are higher. So with original Medicare, if you have worked for 10 years or 40 quarters, or your spouse has, then Part A of original Medicare, your hospitalization, will be zero premium, premium free. Part B, on the other hand, your outpatient services, doctor visits, labs, tests, x-rays, durable medical equipment, that will have a monthly premium associated with it, around $145. It goes up every year. And unless you're eligible for Medi-Cal or Social Security, then you're going to have to pay that $145 a month. And that off the bat is going to be higher for many people than covered California. But wait, it gets worse. See, original Medicare doesn't have prescription drug coverage in it. So you need to add prescription drug coverage, Part D, for drug. And that's going to be that's going to be in the neighborhood of $30 a month. So right off the bat, if you want to stay with original Medicare, it is going to be $145 plus $30, so you're looking at $175 per month for original Medicare. Now, with the covered California health plans, you have predictable costs, co-pays, co-insurance, and a maximum out-of-pocket amount. Once you hit that amount, even if you have a Silver 70, it's like $7,800. With original Medicare, you do not have that. You can re-incur the Hospital A deductible. Once you have moved through the Part B deductible of $198, then you go into 20% co-insurance, and those continue, that 20% continues on with no cap. So if you start getting into real expensive tests and imaging, you're going to be paying 20% of $500 or $1,000. And there's no cap on that like there is with a covered California plan. Now, as you approach 65, you will be bombarded with literature about different plans that are called Medicare Advantage plans. And some of those are very low cost, sometimes zero monthly premium, and they generally include prescription drug coverage. Now, you still must pay your Part B premium, even when you're enrolled in a Medicare Advantage plan, but at least you don't have that Part D cost. But some Medicare Advantage plans, do cost, $25, or maybe $50, depending on the network. Now, that's kind of the downside of the Medicare Advantage plans, that although they work very similar to a covered California plan, with everything included and the maximum out of pocket, there are networks like a covered California plan, and many of the Medicare Advantage plans are HMOs. So you'll have to have a primary care physician. Medicare Advantage plans aren't like the big nationwide PPO of original Medicare. If you want to maintain that original Medicare giant PPO structure, you will need a Medicare supplement if you want some sort of backstop to the liabilities of original Medicare for those deductibles and the 20% co-insurance. So there are Medicare supplements. Plan G is the highest level right now for people turning 65, and it's going to cover everything except the Part B deductible. So that's $198 in 2020, but then the Medicare supplement will cover everything else. But those Medicare supplements, Plan G, you're looking at $150. Now, there are other Medicare supplements that are less, but even if you go with $150 plus your Part B, plus your Part D drug, because you need that Part D drug, you're looking at $325 per month. Now, There may be extra help depending on your income and assets from Medi-Cal. You may fall into a slot, qualified Medicare beneficiary, where Medi-Cal will pick up your Part B premium and co-pays and co-insurance, and that will really reduce the cost. And you can be in a Medicare Advantage plan as well. But you may have too many assets, so you may have to pay the full cost. Now, on the Part D side, Social Security has the low income subsidy program, and that's kind of separate from Medi-Cal. It has higher limits, so you might qualify for some low income subsidy extra help for the Part D from Social Security. Well, that's kind of a different agency you have to deal with. Now, one of the things you have to remember that is if you have not received anything from Medicare, you may have to push your Medicare enrollment. So at least, 3, 4, 5 months before you turn 65, you want to go to socialsecurity.gov and say, I want to sign up for original Medicare Parts A and B, because you need that Medicare card with a Medicare claim number on it. You need the claim number before you can enroll in any Medicare Advantage plan, Part D prescription drug plan, or a Medicare supplement. So you need to get that going. Now, when it comes to Covered California, if you're the only person on your plan, then you can just terminate it. You will gain Medicare on the first day of the month you turn 65. So if you turn 65 March 26, then your Medicare will become effective March 1, which means you will want to terminate your Covered California plan by February 15th. That way you won't get another billing. We have to remember that you can't have Covered California and Medicare, because if you're eligible for Part A of Original Medicare, you are ineligible for the subsidies from Covered California. So you will be paying the full premium amount. Now, you may get some subsidies before you're able to terminate it, and you may have to pay those back. That's why you need to terminate Covered California when you gain Original Medicare, so you are not liable for those subsidy premium payments, monthly subsidy premiums that you receive from Covered California. If there are other people in your household, you do not want to take yourself out of the Covered California household. You just want to remove yourself from the Covered California plan, or whatever plan you happen to be enrolled in, because the Covered California subsidies are based on the household size. You're still in the household, you're still part of the tax unit. So you do not want to remove yourself from the tax household, because that affects the subsidies for the other people. But you just want to terminate your plan within Covered California. Yeah, there's a lot of moving parts going from Covered California to Medicare, getting the card, terminating plans, deciding on what you want to enroll in. Lean on a friend, lean on a family member, lean on an agent to help guide you through this very kind of complicated area. But it all does work. I have a lot of people that have moved successfully from Covered California to Medicare, and they're happy with the coverage for what they have selected. So hopefully that helps you out. If you have any questions, you can leave comments down below. You can go to my website, insuremekevin.com, and my email is on there. And I also have a phone number on there, so you can go ahead and give me a call. And I usually answer the phone if I'm not outside. So you stay safe, and we'll talk to you later. Bye-bye.